neck and back pain are very common problem, and all of us suffer from neck and back pain at some point in our life. Spine is a complex anatomy. There are a lot of questions in the mind of people that how the spine structure and why do we develop these problems. So today let's understand the spine anatomy. That will make a base for us to understand why the spine gets affected and why do we suffer from neck and back pain. If you will look at the complete spine structure, spine can be divided in 5 parts. The uppermost part is cervical spine or the neck area. The middle part is the thoracic spine or the upper back. The lower part is the lumbar spine, and below that we have single piece of bone called sacrum, and the last is coccyx or the tailbone. Cervical spine is made up of 7 different vertebrae. In thoracic spine there are 12 vertebrae. Lumbar spine usually has 5 vertebrae. Sacrum is made up of 5 vertebrae, but they are all fused together, so they make a single bone. And the coccyx is made up of 4 tiny bones, which are attached with each other by cartilage. If you see the spine from the back or the front, the spine should be straight. There should not be any lateral curvature in the spine. If there is a lateral curvature in the spine, it is called scoliosis. If you see the spine from the side, the spine has different curvature, and these curvatures are different in the different part of the spine. In the cervical spine, spine is curved to the front, which is called cervical lordosis. In the thoracic spine, the spine is curved to the back, which is called thoracic kyphosis. In the lumbar spine, the spine is curved to the front again, which is called lumbar lordosis. The last part of the sacrum is attached to the ilium, which is the pelvic bone, and here it makes what is called as sacroiliac joint, and this pelvic bone later on will give attachment to the thigh bone and will make the hip joint here. Now let's look at lumbar spine. The lumbar spine is made up of 5 vertebrae, which are numbered as L1, L2, L3, L4 and L5. If you look at a single vertebra, it's made up of a bulky front part, which is called the vertebral body, and from here we have these pedicles running on each side, and they are connected posteriorly with the posterior arch. This arch is made up of what we call as lamina in medical terms, and the spinous process. So 2 vertebrae are held together with intervertebral disc. So this disc will hold the body part of the 2 vertebrae together. Similarly, we have these 2 joints called facet joints in the back. They are similar to knee joints but smaller. So the 2 vertebrae are held together with 3 joints. One, the disc on the front, and 2 facet joints in the back. So this combination of 2 vertebrae held together is called one motion segment of the spine. Now, between the body and the posterior arch of the vertebra, there is this canal called spinal canal. This canal has the spinal cord running in it. Because these vertebrae are stacked one on top of each other, so this central spinal canal is running all the way from occiput, which is the skull bone, down to the tailbone, carrying the spinal cord in it. Spinal cord actually ends at the level of the L1, and below that there are only spinal nerves, which are called quadra equina, because they look like horse's tail. The function of the disc and facet joint is to hold the vertebrae together, but at the same time allow some motion between them. So this is how we get the flexibility of the spine, by having these movements between the 2 adjacent vertebrae. As the spinal cord is running in the spinal canal all the way from skull to the tailbone, it will branch out in the form of spinal nerves. Between the 2 vertebrae there is a foramen, and from here the spinal nerve will come out. In the neck area, in the cervical spine, these will come together and will make what is called as brachial plexus. The function of the brachial plexus is to supply to the upper extremity for all the functions of the hands and arms. Similarly, in the lumbar spine, these nerves will come together and will make what is called as sciatic nerve. The function of the sciatic nerve is to supply to the legs for all the sensations and movements. Sciatic nerve also supplies your urinary bladder and rectum to have control on the bowel and bladder function. In the thoracic spine, the spinal nerve will supply the chest wall and all the abdominal organs. Now, if you look at the cervical vertebrae, they are more or less similar to the lumbar vertebrae, with a body part on the front and the arch on the back and the spinal cord running in between, with the spinal nerves coming out on the left and the right side at each level. Some of the cervical vertebrae have peculiar shape like C2, which has a finger-like projection called dens, and the C1, which is more like a ring structure. So your spine is not only the structural support to your back and your body, it also carries the spinal cord in it and protects it from any kind of external injury. Also, because of the motion present between two adjacent vertebrae, it provides flexibility to your body for all sort of bending, twisting and tilting movement. I hope this video will help you understand the spinal anatomy, and in the next video we'll talk about why the spine gets affected and why do we develop neck and back pain, which can lead to the nerve compression causing pain in your hands or sciatica. Thank you.